Hi, I'm Gary Bebow, CEO of WRHS Health System. This is my March CEO Connection. I'm really pleased today to have as my special guest Mr. Robert Wright. Robert's been at the hospital, well, longer than I've been here. And so, Robert, when did you actually start?
I started here in March of 1989.
1989. So you're closing in on 29 years?
29 years next month.
And when you came here, you didn't enter right into management when you started, did you?
No, sir. I started working nights and weekends in radiology, worked emergency room, went from radiology into the cardiac cath lab, spent about 5 years in the cardiac cath lab, went into the radiology department for a brief time and became the radiology director, and was the radiology director for a little over 13 years. And have been in administration for six years.
So was this your first job, fresh out of your RadTech training?
First job. I actually started here before I finished RadTech school as a student on the weekends.
I'll be darned. And so you're originally from Melbourne?
Melbourne, Arkansas, yes sir.
And so that's where you call home?
That's where I call home. Well, I've lived in Batesville for 29 years.
But your family pretty much lives in Melbourne?
My family lives in Melbourne, except for my brother. I have to plug him on this.
Yeah.
He lives here in Batesville also.
He does too. Well, we're proud to have your service over those years. You've seen a lot of growth in the hospital over the years. And
I have.
Been a part of it, haven't you?
I have a lot of the growth. You know, the original emergency room is part of the wall in the non-invasive lab now. I remember going out on the back dock there, and now it's part of an office complex.
Yeah. I remember when I came in 1990, 1991. It was there as well. So a lot of the growth you've seen and been a part of, and we appreciate your participation in that. But most recently, you know, the administrator in charge of our clinic division. So that's got some challenges and opportunities, doesn't it?
It does have some challenges and some opportunities, and I'm really proud of what we've accomplished. 4 years ago, we had about 120 to 130 people working in the clinics and about 35 providers, and now we have 450 employees and 90 providers. We've opened up a clinic, as you're well aware of, in Heber Springs in the last year. We expanded the complex in Newport, and we put the Southside Clinic in the last year.
Just seems like it's constant growth. Plus some other doctors in Batesville become employed by us now too.
We have most every employee in Batesville, or every physician in Batesville now is employed, with the exception of about 4. But you know, our latest acquisition was the White River Diagnostic Clinic, was in July of 2017, and that's progressing well. They've come on board and they're part of the team, and I believe they're proud to be part of the team.
Well, really, one of the most important parts of your job is to have a great relationship with physicians and providers, and mutual respect. And clearly, over the years, you've earned that.
Well, I think it does show that I understand that we're all in this together. We're a large hospital in a small town, and it's our hospital, and they take great pride in that, and so do I.
You know, you got some exciting things going on right now in population health.
We do.
Why don't you talk a little bit about population health?
We do. In January 1st of 2018, we were accepted into the Medicare Shared Savings Program, which will allow the White River Health System physicians and actually some independent physicians also, that's part of our accountable care organization. It will allow us to participate in Medicare Shared Savings. They will set quality metrics for us, and they will set a cost target, and if we're able to basically keep our population healthier and make it cheaper on Medicare, then they will share that savings back with the facility and the providers.
You know, the responsibility of hospitals now extend way beyond just the walls of a hospital or the clinics. It really extends out in the population. So it's important, those initiatives that you're involved in as this organization evolves. So well, I appreciate you coming in today, and thanks for the leadership you've had at the hospital. It's a better organization because of your involvement. So
this is my home for the last 29 years, and I take it personal.
Great, thanks. All right. I have 2 employees of the month to recognize. First of all, Stone County Medical Center. Brian Wilkie is an RN at the emergency department at Stone County Medical Center. He's been there for 9 years, and he's being recognized for his positive demeanor. So be sure to recognize Brian when you see him over at Stone County Medical Center. At White River Medical Center, Bailey Williams, our COM Health Coordinator, has been recognized for being involved. Bailey's been with us for a couple of years, and appreciate the work that she's doing there as well. So if you see Brian and Bailey out and about the system, be sure to recognize them for their being Employee of the Month. During March, we recognize National Colorectal Awareness Month, National Kidney Month, and National Nutrition Month. So if you know employees in any of those areas, be sure to recognize them in their efforts towards those services. We have an important event coming up on March 31st. It's called the Toast and Roast, and where we will honor 4 physicians from White River Medical Center that has had a great impact here at the facility in Batesville. Dr. J.R. Baker, Dr. J.D. Allen, Dr. John Lambert, and Dr. Robert Walton will be toasted and roasted on the night of March 31st. And so if you're interested in participating in that event, be sure to contact the foundation at 870-262-1834 for tickets and other information. I think it's going to just be a great night, recognizing these guys as well deserved for all the time and effort that they've spent taking care of our community. The flu season is in full bore right now, and I wanted to announce that we have the flu clinic that's open at Dr. Gibson's office on Tuesday through Friday from 7 a.m. to 5:30 p.m. And we also have a flu clinic is open at the WRHS Medical Complex at Southside on Saturday and Sunday from 8 a.m. to 8 p.m. And so in the event that you have symptoms of the flu, or friends or others that have symptoms, those are convenient alternatives to the White River Medical Center emergency room or Stone County Medical Center emergency room in case anyone needs those services. In March, there will be a health insurance dependent audit being conducted by CoreSource. You will receive some information in the mail that will explain the audit, and you will receive a packet during this month of March. If you have any questions on what will be required for documentation on each of your dependents, be sure to contact Paula Mosier in Human Resources. In March, Gary McDonald will retire from White River Health System. Gary's headed up our Human Resource Department for almost 10 years now, and in addition to Human Resources, he's also had other administrative responsibilities. Most noteworthy recently has been in the construction area. So during this month of March, when you see Gary, be sure to thank him for his years of services and express your appreciation and hope for a happy time in his retirement. So best regards to Gary as he ends this chapter but starts a new chapter in his life. Finally, I want to speak about a new position at White River Medical Center. Recently, we have appointed Gary Paxson as the administrator of White River Medical Center. Really, the purpose of the appointment is to have Gary take responsibility for the daily operations at the hospital, and I will become the White River Health System Chief Executive Officer, taking more of a responsibility for the overall guidance of the health system. So clearly, Gary's done a wonderful job in our quality advancements at White River Medical Center, and I really think he'll do a super job as our administrator of the hospital. So when you see Gary out and about, and the rest of the administrative team, be sure to provide your support for the things that they're going to be implementing, because I'm confident that they'll be a great step forward. So thanks a lot. That concludes my CEO Connection for March. If you have any questions that I might be able to answer, or if you have any suggestions on how we can do a better job going forward in the CEO Connection, please be sure to let us know. So thanks and have a great month.